debate. The Honourable Member for Vancouver Kingsway.
Thank you, Madam Speaker. Madam Speaker, in politics, it is imperative to speak truth to power. This is especially the case when matters of life and death are involved. Today, I rise to speak this truth. Canada has utterly failed to protect vulnerable long-term care residents and workers throughout the COVID-19 pandemic. And this failure has cost the lives of thousands of Canadians. According to the National Institute on Aging, 2,611 long-term care facilities and retirement homes across Canada have been ravaged by COVID-19 outbreaks. This has led to the deaths of 14,802 residents and 27 workers, representing 67% of all COVID-19 deaths in Canada to date. This is the worst record of any nation in the OECD. And worse, successive governments allowed this to happen with eyes wide open. Despite repeated warnings, we did not act in time to prevent or meaningfully abate this humanitarian disaster. During the first wave of this pandemic, more than 840 outbreaks were reported in long-term care facilities and retirement homes across Canada, accounting for more than 80% of all COVID-19 deaths in the country in the first 6 months. Again, this represented the worst record among all comparable nations and double the OECD average. The situation was so dire that the Canadian Armed Forces had to be called in. And what they found was appalling. Residents were discovered underfed, abandoned, and afraid. In some cases, they had been left to die, alone, in bed, covered in their own urine and feces. These stories shocked our conscience and challenged our self-image as a compassionate and humane society. However, this shock quickly turned to outrage as Canadians learned that for-profit operators were paying out millions of dollars in dividends to their shareholders while accepting public subsidies and neglecting the residents under their care. Last fall, as Canada sat on the crest of a second wave of COVID-19, the federal government pledged to, quote, work with the provinces and territories to set new national standards for long-term care, end quote. They also pledged, quote, to bring in criminal code amendments to explicitly penalize those who neglect seniors under their care, end quote. Unfortunately, it has failed to make any meaningful progress on these commitments to date. As a result, the second wave of the COVID-19 pandemic has proven to be even deadlier than the first for long-term care and retirement home residents. In total, 7,470 residents succumbed to COVID-19 throughout the recent resurgence, compared to 7,022 deaths during the first wave. As Canada's Chief Public Health Officer, Dr. Theresa Tam, recently noted, I think the tragedy and the massive lesson learned for everyone in Canada is that we were at every level not able to protect our seniors, particularly those in long-term care homes. Even worse is that in that second wave, as we were warned of the resurgence, there was a repeat of the huge impact on that population. Madam Speaker, there is simply no excuse for our country's repeated failure to act. This carnage was entirely foreseeable and avoidable. We must ensure this never happens again. If we cannot come together now to address the systemic deficiencies in Canada's long-term care system, when will we ever? COVID-19 has laid bare a fragmented and under-resourced long-term care system across Canada that's heavily reliant on for-profit.
The Honourable Member of Vancouver Kingsway, the Honourable Member for London Fanshawe is rising on a point of order.
I apologize to my honourable colleague, Madam Speaker, but I believe he had failed to mention that he will be splitting his time with the member for South Okanagan West Kootenay, and I'd like to provide him with the opportunity to do so. Thank you, Madam Speaker.
Honourable Member for Vancouver Kingsway.
Thank you for that. I was going to say that, but I should have said that at the beginning. So yes, I will be splitting my time accordingly. Thank you for that. So, several studies conducted through the pandemic have found that outbreaks in for-profit facilities have been more extensive and led to more resident deaths. Indeed, decades of research have demonstrated that long-term care facilities run on a for-profit basis tend to have lower staffing levels, more verified complaints, more transfers to hospitals, and higher morbidity rates. This should come as no surprise, since for-profit management practices are designed to generate returns for investors rather than provide high-quality care. These include paying the lowest wages possible and hiring part-time casual workers and those defined as self-employed in order to avoid paying benefits or providing other protections. These workers often cannot afford to stay home when they are sick, and they can carry infections from facility to facility, as we so deadly learned. And for-profit models incentivize and reward cost-cutting. Indeed, we have heard countless stories of for-profit operators locking up personal protective equipment, leaving staff exposed, and rationing vital items like soil pads for incontinent seniors. A recent review of the contracted long-term care sector in British Columbia, titled "A Billion Reasons to Care," found that while receiving on average the same level of public funding, there is a pattern of the contracted long-term care sector where for-profit operators pay lower wages, with care aides in for-profit facilities being paid as much as 28% or $6.63 less per hour than the industry standard. Not-for-profit care homes spend $10,000 or 24% more per year on care for each resident compared to for-profit facilities. And for-profit care homes failed to deliver 207,000 funded direct care hours per year, whereas not-for-profit care homes delivered 80,000 hours of direct care beyond what they were publicly funded to deliver. Madam Speaker, New Democrats believe that every dollar that flows to long-term care should be spent on residents, not siphoned off for corporate profits and shareholder dividends. We know that healthcare is best delivered through a nonprofit model, both on health and access grounds. Research clearly demonstrates a systemic pattern of lower quality care in for-profit care homes, while there is little, if any, evidence demonstrating benefits from providing public funding to for-profit facilities. That is why the NDP motion before this House today calls on the federal government to implement national standards for long-term care that fully removes profit from the sector. We know that this will not be accomplished overnight. However, with federal leadership, we believe it will be possible to transition all for-profit facilities in Canada to not-for-profit management by 2030. As a first step, New Democrats are calling on the federal government to work with the provinces and territories to freeze licensing for new for-profit facilities and to ensure that measures are in place to keep all existing beds open during the transition. After decades of underfunding and cuts in Canada's long-term care sector, this strategy must be backed up by significant new federal funding tied to binding national standards of care and the principles enshrined in the Canada Health Act. The Conference Board of Canada estimates that an additional 200,000 long-term care beds will be needed across Canada by 2035, requiring $64 billion in capital spending and $130 billion in operating spending. However, the Conference Board's cost-benefit analysis found that the benefits of these new beds are greater than the costs, even without considering the improved health outcomes. In fact, these investments are projected to have a positive impact on the economy by contributing a net $235 billion to real GDP and supporting 120,000 jobs every year. Similarly, the demand for nurses to provide continuing care for seniors would create an increase of nearly 80,000 full-time jobs. Simply put, Madam Speaker, our parents and grandparents built this country. They sheltered and nurtured us when we were young and vulnerable. In turn, we have a duty to take care of them as they age. But COVID-19 has revealed a bitter truth. We have abandoned this responsibility as a country. Let no one claim that we don't understand the consequences of this collective neglect. It's time to make this right. I ask every colleague in this House to join New Democrats today to start the work to do so. Thank you, Madam Speaker.